One of the most common heart conditions associated with sleep apnea is atrial fibrillation. So can we talk about this, doctor, using the 3D model behind you?
Sure. First, to give you some perspective, atrial fibrillation is a very common arrhythmia where the cells of the upper chamber don't beat in a synchronized fashion. As a result, the lower chamber, the main pumping chamber, starts beating very fast and irregular. The concerns of atrial fibrillation are you feel short of breath, you feel your heart racing, but more importantly, as I'll show in a second, there's a little area of the heart where blood clots can form. So people with atrial fibrillation are at a much higher risk of stroke. 20% of strokes are from atrial fibrillation, and the people didn't know they had atrial fibrillation. So if we can prevent atrial fibrillation, recognize who has it, and treat it, we'll be preventing a lot of problems, including strokes. And also, atrial fibrillation is related to age, so we have a lot more of it in our society as we have an aging population. How sleep apnea relates to atrial fibrillation is complex. Some of it has to do with the fact when your oxygen levels drop during an apneic episode, it produces the adrenaline surge, which can stimulate your cells to produce arrhythmias. Some of it's when you have these constant drops in oxygen, you get an inflammatory state, so the inflammation of the cells may lead to atrial fibrillation. But I'm going to show you this graphic and explain to you something that's happening in the chest that might make some sense. And what you have here is we're looking at the heart kind of from the back, from the side. So your main pumping chamber is here, the ventricle. The atria are chambers that are in the back of the heart. The atria receive blood from the body and the lungs, and they pump them to the main chamber. And the atria is where the electrical impulse of our heart starts. There's a group of cells that start the impulse, and it travels through the upper and lower chamber. Why is this relevant? Well, the heart sits in our chest cavity. And as we explained, when you have this apneic episode, you have to generate a negative pressure in your chest to pop that airway open. And it's been shown that this negative pressure in your chest, the vacuum that's trying to suck air in, could be negative 100 millimeters of mercury. So think of our air, the pressure in our air at ground level is 0, a negative pressure of 100 millimeters of mercury, and as a result, this chamber stretches. You have this vacuum sucking these atrial chamber to make them bigger. And the bigger they are, and the more stressed they are, the less the electrical impulse can travel to the lower chamber, and that can lead to atrial fibrillation.